why we are studying psychopharmacological therapy in the course of psychotherapy, because it is largely practiced by those who are basically trained in medical sciences and are psychiatrists by profession. One of the main reason for studying psychopharmacological therapy as a student of clinical psychology is that while providing counseling or psychotherapy, we will come across clients who are already on medications, and many of their behavior and signs and symptoms may be related to those pharmacological therapies. So, if you are knowing the behavioral changes that are associated with its use or its uh, abuse, or even when these medicines are stopped, some behavioral changes, signs and symptoms, or sometimes withdrawal symptoms are observed. So, if you are aware of the psychopharmacological aspect of the therapy, you will be better able to understand your client and to provide them further suggestions and referrals if needed to psychiatrist, or you will be able to do the differential diagnosis whether the symptom is because of the core psychological problem or because of the psychopharmacological agents. So, this is in brief that why psychopharmacological therapy should be included in a course of psychotherapy. As you all know, that psychotherapy is treatment of the psychological problems, mental disorders, using the principles and theories of psychotherapy. So, if you are healing the psyche using some chemical agents, some medicines, then it is not psychotherapy. It is basically psychiatrists. They follow the biological model and they use that. So, for being called psychotherapy, it is essential that the therapeutic tool or agent must be based on some psychological theory or principle. Therefore, I thought that you should know why psychopharmacological therapy. So, we are not going in detail, we are not psychiatrists. This whole lecture is based on the basic idea that we should know the psychopharmacological agents generally used for treating various types of mental disorders, their indications, their side effects, and other aspects of those psychopharmacological therapeutic agents. So, before I begin, what types of psychopharmacological agents are used? And I have already shared the lecture notes with you, and hope you must have gone through those lecture notes. So, it will be easier to comprehend what I am going to discuss in the next few slides. So, before we begin the discussion of various psychopharmacological agents and for what types of mental disorders they are used, it is essential to know the basic concepts of pharmacology itself. And two important or basic concepts related to pharmacology are pharmacokinetics and pharmacodynamics. One is what does drug with the body when we ingest drug, what that drug is doing with the body, what changes in the body is taking place, and the other is what body does with the drug. So I will come in the detail. So first let us take the concept of pharmacokinetics. This word has been coined from the Greek word pharmakon, meaning drug, and kinetikos, that means putting in motion. So, the pharmacokinetics is a branch of pharmacology dedicated to the determination of the fate of the substance ingested or administered externally to a living organism. So, when some substance is ingested or administered externally, say through injection or say through uh, dermal route or any other route, if some chemical substance is going within the body, then what will happen with the substance? How the substance will go under different cycles of changes is the study of pharmacokinetics. So it is basically what body does to the drug. When you ingest, the drug is absorbed, say for example, it will be distributed in the body. So all these things, what the body is doing with the drug is called pharmacokinetics. And generally, pharmacokinetics is divided into several stages, several steps or areas. And the main steps or main areas of those pharmacokinetics are absorption, distribution, metabolism, and excretion. Sometimes it is called ADME, the first alphabets of each. So, this ADME may be considered as a phase. I said earlier that it is a phase of pharmacokinetics. So, when the substance is ingested or it is administered, first it is absorbed by the body. So, what is absorption? It is the process of a substance entering in the body. When the substance enters into the body, then the second phase is distribution. It is the dispersion or dissemination of the substances throughout the fluids and tissues of the body. So, when the whole drug or medicine is distributed in different parts of the body, then that is called distribution. And metabolism, it is a popular term, you must be aware that it is defined as irreversible change or transformation of substances and its daughter metabolites. So the substance transforms it into a different substance, different, and this transformation is irreversible. For example, if you change milk into curd, then you cannot make the curd or transform the curd into milk. So when drug is absorbed, distributed, most of the drugs are metabolized in the body, and none of the drugs they stay forever in the body. If it to happen, then there will be no need of taking medicines again and again. So when we take medicine, the body eliminates this also, and that the process of elimination of the substance from the body is called excretion. So when you ingest some medicine or drug or some pharmacological agents, then the final effect of that drug or that chemical substance depends on these four phases: the final nature of the externally administered drug and its concentration in blood, which ultimately determines its therapeutic effect. Related to this are some other concepts that we should know. First is rate of elimination. By what rate the substance is eliminated from the body. It is a constant fraction of the drug in the body which is eliminated per unit time. So, per second, per minute, per hour, what fraction, what proportion of the drug is eliminated from the body? This is called rate of elimination. And this rate of elimination is proportional to the amount of drug in the body. Second is the volume distribution. I am skipping this. The more important concept that we should focus, I have already said this, you can go through this, is the last one, the elimination half-life. So when this elimination process starts, when this excretion process starts, the elimination half-life, generally referred as half-life of the medicine, is the time taken for plasma concentration, the plasma concentration of the drug, to reduce by 50%. So suppose I have taken 100 mg of substance and say the plasma concentration is also 100 mg. So the time by which it becomes 50 mg will be called its elimination half-life or half-life. The time by which only the half amount of drug remains in the body is called half-life of that drug. Larger the half-life of the drug, the longer will be its effect. So, the half-life of the drug or medicine determines how frequently we need to take it. Suppose if the half-life of a medicine is very short, then we will be taking it 3 times, 4 times daily. It is relatively long, then we will be taking uh, twice a day. And if it is very long, we may be taking one a day. And many medicines, you will be aware that we take once in a week. So how much amount of drug and its frequent dosing is required depends on the elimination half-life. Longer the half-life, less frequent dosing is required. Shorter the half-life, more frequent dosing is required. Another aspect of pharmacology is pharmacodynamics. The pharmacokinetics is what body does with the drug, and the pharmacodynamics is just opposite. What drug does with the body. So pharmacodynamics is the study of the biochemical and physiological effects of drugs on the body. And the effect of drug depends on several factors, several things such as drug concentration, site of action. So if you are taking a drug and its concentration is very low, its effect will be very low, very little. Suppose you are taking a drug and its concentration remain high for a longer time, then it will be more effective. Similarly, where the drug is acting, it also determines the effect of the pharmacological agents. So the drug may have several effects on the body, such as depressing, stimulating, replacing substances, destroying cells, and so on and so forth. And here you should not confuse that depressing is related to the psychological condition of depression. So, if I am taking a drug, some of the biological processes are say slowed down, so I will say that it is having a depressive effect. And similarly, if some of the bodily activities are enhanced or increased, activated, then it will be called stimulating. So some drugs have uh, depressing effect on the different organ systems. For example, when we take anxiolytics, the major tranquilizers or hypnotics, they are having central nervous system depressing effect. Our central nervous system is depressed. On the other hand, when we are taking antidepressant, psychostimulants, they arouse our central nervous system. So the effect of the drug depends on whether it is depressing the central nervous system or whether it is stimulating. Similarly, some uh, pharmacological agents may replace some of the chemical substances that are not wanted for us. So, by replacing those unwanted substances, it may bring the therapeutic effect, and some may destroy the cells. For example, the chemotherapy done for cancer, it generally goes to the particular site where the carcinogenic growth is taking place, and those chemical agents destroy the cells there. So there are different routes through which the drug influences the body. The desired effect of the drug may come from different mode of action, such as chemical interaction, interaction with the enzymes, interaction with the proteins, changes in the level of neurotransmitters and neurotransmitter receptors, so on and so forth. For example, you all know that the newer class of antidepressant called selective serotonin reuptake inhibitors. They inhibit the reuptake of the neurotransmitter called serotonin, which is considered responsible for depression. Low level of serotonin is often linked with depression. So those SSRI, selective serotonin reuptake inhibitors, they inhibit the reuptake of serotonin and therefore the amount of serotonin increases and it brings the antidepressant effect by increasing the serotonin, but by what route? By inhibiting the reuptake of the neurotransmitter serotonin. So these are the different routes through which the drug influences the body. So let us recap all the things. Two aspects. One is pharmacokinetics, means when we ingest the drug or medicine, or when the drug or medicine is administered externally, what amount of the drug remains in the body, to what part of the body it is distributed, with what rate it is distributed. All these things are related with pharmacokinetics. And to know how the drug will influence the body, that is the pharmacodynamics. So those, the pharmacokinetics influences the pharmacodynamics also. So they are interlinked with each other, and to better prescribe the drugs, we must be aware of these aspects of the medicines, the pharmacokinetic of that medicine and the pharmacodynamics of that medicine. So, why we should know the pharmacokinetics and pharmacodynamics? Because to be more effective in choosing the first line agent for a specific disorder. So, there are a number of medicines for a given disorder. Which medicine has to be prescribed? It depends on its pharmacokinetics and pharmacodynamics. For example, if there is a medicine which is generally having a harmful effect on the liver, and there is alternative medicine which is for the same disorder but not having any adverse effect on the liver, and you are knowing the pharmacodynamics of these two medicines, and suppose a patient comes who is having some liver dysfunction or liver problem, your first line agent will be that drug which is not liver toxic. If it is hepatotoxic, then you will not prescribe it. So to be more effective in choosing first line agent, we must know the pharmacokinetics or the pharmacodynamics of the medicine to more effectively prescribe it in the presence of other medicines, either psychotropic or non-psychotropic. Suppose any patient is taking some other medicine, if you are not knowing how these medicines interact with the other medicines, then you will not be able to prescribe. So, knowing this pharmacological interaction of the medicines is also essential, and these interactions are studied under the broader umbrella term of pharmacokinetics and pharmacodynamics. And finally, the knowledge of pharmacokinetics and pharmacodynamics also help us in dealing with other factors that may alter the pharmacokinetics, such as age or other disease state. Many medicines are not good for older people. Many medicines can be prescribed for older people. Similarly, for some disease states, suppose you are prescribing some antidepressant and it is cardiotoxic, and suppose your patient is having a disease related to cardiovascular system, then the prescription of that medicine will not be good. So, if you are knowing the pharmacokinetics and pharmacodynamics, you can consider the other factors like age, disease state, and many others. So, taken together, I will say that for better prescription, for better understanding the effect of the drug, we must not be knowing only the pharmacodynamics, that how the drug affects the body, but also we should know how the body interacts with, body deals with the drug or medicine, that is the pharmacokinetics. So this is in brief the background. I am not going in detail and I cannot go in detail because we are not the student of psychopharmacology even. We are just studying one unit in the broader course that is called therapeutic techniques or psychotherapy techniques. So for today, I am leaving this lecture at this point, and from next class, I will start dealing with those pharmacological agents which are used for treating mental disorders. They are generally called psychotropic drugs. And broadly, they are classified into six categories: antipsychotic or neuroleptics. These are the categories or classes of those medicines which are used to treat various psychotic conditions like acute schizophrenia and other forms of schizophrenia and psychosis. Anxiolytics, as it is clear by the name, that those medicines which helps to reduce anxiety are called anxiolytics. So, for treating anxiety and related disorders, we use a special class of medicine that is called anxiolytics. I will detail all these six classes in the next lecture. The third category of medicines or psychotropic drugs which are used in treatment of mental disorder is hypnotics. These are some selected benzodiazepines and even some non-benzodiazepine medicines which are used for treatment of insomnia. So if insomnia is the primary concern, it is not the outcome of any other disorder or disease. It is not the byproduct of any disorder or disease. The major problem itself is insomnia, then hypnotics are generally prescribed. Antidepressant, as it is clear by the name, that those medicines which reduces the depression, which are used for the treatment of depression, they are called antidepressants, and there are many classes that I will discuss you when I will be dealing with this particular class that is called antidepressant. One thing you should know, that like anxiolytic, earlier it was called by some academicians as thymolytic. Thymos means emotion. So initially they labeled this as thymolytic, but this is a misnomer because these drugs, they, and when I am using the term lytic, means those which reduces or which takes away the symptoms of anxiety will be called anxiolytic. If it is taking symptoms of emotion, then it will be called thymolytic. But antidepressants, they do not reduce all the emotion, they reduce the feeling of sadness and all negative emotions. So thymolytic was though the earlier term, but it is now not used and it is called antidepressant. The next class is called mood stabilizers, or sometimes it is also called antimanic. These are the medicines which are used for treating bipolar disorders. Though it is for stabilizing the mood and treating mania, but sometimes it is also used for treatment resistant depression condition. I will be dealing with all these aspects when I will discuss the mood stabilizers in detail. And the last class of medicines that are used in treating mental disorders is called psychostimulants. They are medicine which are used for treating such conditions like ADD, ADHD. So these are six broader classes. And in the next lecture, I will cover all these six medicines one by one. Thank you for listening to this video, viewing this video. Thank you very much. We will meet again. And in the next lecture, I will be discussing all these six classes of agents one by one. And unfortunately, I cannot take up questions. But you are having some questions related to this lecture or the lecture note that I have shared, you may ask through WhatsApp group or other.